vitamin B12 or vitamin D3, a huge percentage of these patients will find their vitamin D and vitamin B12 to be deficient. After surgery, you require those supplements of vitamin D and vitamin B12, which is normal. Even if you do not do surgery, actually you will require these supplements, and anybody after the age of 40 is also recommended to take vitamins. So, taking vitamins is something which is actually recommended after bariatric surgery, but as I am saying that most of us are deficient in these vitamins otherwise also. So, my suggestion would be that all of you should do your vitamin test and see if you are deficient, you should start taking them even if you are not a candidate for bariatric surgery. Another common myth is that after bariatric surgery you may not be able to eat lot of amount of food, which is in fact truth. What we advise after bariatric surgery is to take small meals, chew well, do not gulp the food, chew them well and then swallow. If you eat slowly, if you eat a small amount, if you eat frequent meals, you do not feel hungry often, and this is also considered to be a healthy way of eating. People who are not obese also should eat slowly and chew their meal well. This reduces the amount of food which you eat normally on daily basis. Nausea and vomiting again is considered to be a problem after bariatric surgery, but most of the time this happens because of not eating properly, not chewing your meal properly, or taking large portion of meals, or drinking water along with the meals. So, what is recommended is do not take liquids half an hour before your meal time and half an hour after your meals. Take a small amount of meals, chew them well, eat slowly, do not gulp your food, and you will not have these problems. Sometimes it takes time to realize your capacity of new stomach, because you always relate the amount which you are eating now or you can eat now with the amount which you used to eat before surgery. That is not recommended. One has to realize the capacity of the new stomach and eat according to the size of the stomach. If you will overstuff yourself, it is likely that you can vomit. I think another common thing which people think is that once you have done bariatric surgery, you are done with it and you can do whatever you want to do, you can eat whatever you want to eat. I think that is not true. Bariatric surgery is a platform where you will lose weight, but to have a sustainable weight loss, what is important to understand that you need to change your lifestyle. It is high time. You have abused your body for so long. Let us now take a pledge that we are going to change our life. When I say change your lifestyle, what I mean is develop a habit of doing regular physical activity, which could be any. You do not have to burn your calories going to gym all the time. You can do brisk walking, you can pick up a sport, you can pick up a hobby like dancing, like aerobics, like doing yoga, swimming. These are some of the ways with which you can increase your physical activity and burn calories. Eat healthy, that is what we say. We are not saying starve, we are saying eat healthy. Whenever you are hungry, eat a snack which has high protein content rather than fat or carbohydrate. We absolutely do not want you to be hungry. You can take protein shakes if you want, protein supplements in any form. There are protein bars available. You can eat sprouts. All these healthy things are available. You can eat tofu, you can eat egg, you can eat grilled chicken, you can eat grilled fish if you are non-vegetarian. So, there are a lot of options available for you to snack healthily rather than eating unhealthy food whenever you feel hungry. Binge eating is another problem with some people, that we continue to eat all the time irrespective of our hunger. We are not hungry, we are full, but we still want to eat. I think you have to curb that habit. You have to train your mind to say no. If you are hungry, then only eat, and when you eat, eat healthy. Post-operatively, I think it is very important to remain in follow-up to have a good result. It is very important to incentivize yourself for losing weight in whatever way you feel fit, except for allowing you to eat unhealthy food. I think I have said what I had to say. I will be happy to take any questions which are coming live. I can see there are a lot of questions coming on the live streaming, and I would now take one by one these questions and answer them. So, this is Rita from Mumbai, and she is saying that her weight is 110 kilograms and her height is 5 feet 3 inches, and she wants to know whether she fits for bariatric surgery. Yes, you are a candidate for bariatric surgery, and you will benefit from bariatric surgery provided you understand that what I have just said, that bariatric surgery is just one way of losing weight. You will need to change your lifestyle after surgery, but you will have very good results. And one can also decide what kind of surgery you need. You need to see your doctor closer by, or you can write to us with your details and we will write you back telling you what kind of surgery will suit you, and we can take on from there. Thank you very much. Okay, so there is another comment from a lady who is from Nagpur, and she says that she has undergone bariatric surgery 2 years back and she is very happy. She has lost weight and also her diabetes has been completely cured. Yeah, so I think that's what we have been saying, that bariatric surgery not only helps you in reducing weight, but it also helps you in curing your or controlling your some of the diseases like diabetes. So, this is Ashwani Gautam. He says, doctor, what is the difference between being overweight and obese? So, Ashwani, as we said that overweight is up to 30 BMI and obesity is after 30. Anybody who has a BMI of more than 32 is called morbidly obese. Anybody who has a BMI of more than 40 is called grade 3 obesity. Anybody who has a BMI of more than 50 is super morbid obese. Another question is from Durgesh Bhuta, who says, does obesity affect heart's health? Yes. Imagine a body which has been created by God for 70 kilograms of weight. So, the heart is tuned to pump blood for 70 kilograms, and now unfortunately you have become say 100 kilograms. So, now heart is overworking to take care of 100 kilograms of the body. So, it has to pump with more force, it has to pump more frequently. Obviously, all this is going to cause burden on the heart, and by losing weight you can actually improve your heart health. Now, I have Mr. Ali Mohammed who says, Dr. Saab, thanks for coming online. What is the best way to lose weight? Well, Mr. Mohammed, I have to confess that the best way of losing weight is natural, and that is healthy lifestyle, healthy eating and doing exercise. But if you are not able to follow this routine, or if you are not able to reduce weight in spite of all this, then one has to consider bariatric surgery if you fit the bill. Mr. Harshal Arora says, my height is 5 feet 11 inches and weight is 104. What should be a healthy weight to target for year 2018? Well, a very simple formula for your ideal body weight is height in centimeter minus 100. So, if somebody is 150 centimeter minus 100, so ideal body weight is roughly 50 kilograms. So, obviously you are grossly overweight, and if you want to lose weight on your own, you should start practicing healthy lifestyle and have small targets for every month which are realistic. Do not keep targets which are unrealistic, which will be difficult for you to achieve. The trick is to keep small targets and follow them religiously. Akshat Raut, she says, my family has an obesity problem. Dad and uncle and brother all are obese. Is there a way we control the weight for all of them? Yes, as I said, Akshara, that there is no magic wand. You really have to work hard to maintain weight and practice healthy lifestyle. The best is not to reach a situation where you need to reduce weight, and if you practice healthy lifestyle from the beginning, you will not reach this state. Another question from Gautam. Gautam says that he has obstructive sleep apnea, he snores a lot while sleeping, his family actually is quite disturbed about this, nobody is willing to sleep with him, he has to sleep alone in one of the rooms, and he is very disturbed about this fact, and he also feels that whether he should tell this problem to his fiancée, this should not affect his married life. I think it is a very valid question by Gautam, and one has to realize that obstructive sleep apnea is a very disturbing problem. You see sometimes most of the people will lose their snoring or cure their snoring within 7 to 10 days, and because the fat around the windpipe burns first, and that is what leads to snoring voice, and once you lose that weight, you are able to actually sleep without any noise, and your partner and your family becomes very happy. So yes, I think you should discuss this problem with your fiancé beforehand, and also you should undergo bariatric surgery. In my opinion, this will completely cure your problem. We have another question from Sonia Ghai Bhatia. She says, after the surgery I am having hair loss. It has been 4 to 5 months after surgery. Yes, Sonia, I think hair loss is a problem after weight loss of any kind. If you lose weight by your own method, by natural method, even then you can have hair loss. But once your weight becomes stable, your hair start coming back and the fall stops. You should also consider any other cause of hair loss like dandruff or any nutritional deficiencies. Go to your specialist, and if take vitamin supplement and make sure that your health of your hair is fine, but once you stop losing weight, your hairs will grow back. So another question by Miss Raut is that she is scared of surgery, but she is having a lot of problems because of her weight, and she is asking for any other alternate. Well, unfortunately, Mrs. Roth, we all know the natural method of weight loss is healthy eating, as I am repeatedly telling this, healthy eating and physical activity. Please try that genuinely. If you are not able to do that, opt for bariatric surgery. To be nervous about the surgery, to be scared of surgery, I think these are all very normal and natural phenomena, but one must understand what are you doing, what for. So if you need to live healthily, if you need to live a normal lifestyle, I think losing weight is of importance, and if you can lose it on your own, very good, nothing like it. But if you can't, don't spoil your life, don't compromise, seek help, get bariatric surgery, go to some good center around you. I am sure they will be able to help you. Yeah, so there is another question that what is your opinion about incidence of cancer in obesity? Well, we all know that, as I said in my talk, that cancer is also one of the diseases which is commonly found in people who are obese. And if we talk about men, thyroid, food pipe, stomach, pancreas, liver, colon, rectum, prostate, these are some of the cancers which are more common in people who are obese. Obviously, that does not mean that non-obese people will not have cancer, but the chances or percentage is higher in people who are obese. One should prevent obesity to prevent cancers, that is known. WHO recognizes that obesity is a major factor for cancer. But yes, if you are very obese and you have a family history of cancer, it is very important for you to lose weight. Whichever method you choose, whichever method is convenient to you, whichever method is effective for your weight and height, one must choose. One must not shy away from choosing bariatric surgery if it is required for you. Okay, I have another question from Mrs. Singhal. Okay, she's our own patient who has undergone bariatric surgery 3 years back, and she says her weight was 130 kilograms and today she has lost around 60 kilograms and she is very happy. Her family life has become much better and they share very intimate relationship with her husband, and she is very happy about it. Yeah, thank you, Mrs. Singhal, and that brings me to a point where we say that how bariatric surgery improves sexual life. We all know that because of obesity there can be a lot of problems in interpersonal relationship of husband and wife. There can be disinterest of sexual life, there can be decreased performance, there can be reduced hormone levels in the body. Because of altered body image you can lose confidence in yourself. All these are some of the factors which can lead to reduce sexual pleasure in your married life. And bariatric surgery not only improves your body image and gives you a psychological boost, it also improves the hormonal levels, sexual hormonal levels of the body. So, these are some of the things which leads to increase or better sexual life. Yes, this is a known fact and I think that is a very important fact. Thank you, Mrs. Singhal, for giving us compliment. I think I am done for today, and if you have any other questions you can write to us. You can ask right now or you can write to us on our mail, on our BLK mail ID, and we will be very prompt in replying these questions. Thank you.
BLK Super Speciality Hospital, a passion for healing.